Hi, I'm Dr. Mai and I'm at Cooganbergen Beauty Clinic. So I have Joseph here. Joseph is 66 and he's coming in today for a skin consultation. What I want to focus on this segment is a little bit more about regenerative aesthetics. So Joseph, can you tell me what are your kind of main skin concerns?
I suppose wrinkles.
Wrinkles, okay. So part of the skin consultation involves a few different pillars. So one of them is skincare in regards to especially bioactive ingredients. Joseph, we kind of spoke earlier about this, but I'm guessing you don't use a retinol or vitamin C
No.
or anything like that. Again, Sheila is a skin expert. She's got a whole range of skincare of which she can make recommendations of ways to improve your skin with really good skincare brands. So I'm going to move on and I'm going to talk really about skin integrity. So Joseph mentioned that, the wrinkles bother him. So, we kind of ask ourselves, okay, well, we just give Joseph some Botox. Now, unfortunately, with Joseph, a lot of his lines are quite well established. They're called static lines and they've been accruing over the last 66 years of life, Joseph. So the case here is yes, Botox will help reduce the movement of lines, but those lines are already set. It's going to be really hard to reverse them at this stage. So, but there are options. So in this case, what I actually would recommend is improving the skin integrity from the outside to the epidermis down to the dermal layers. A whole pillar of different types of regenerative treatments. A lot of them are based around platelet-rich plasma. So platelet-rich plasma, Joseph, is actually taking a vial of your blood.
Yep.
We take it and we centrifuge it or we spin it down. We separate it into the really good plasma, which I consider liquid gold. There's about 1% of platelets in it, which also contains loads of valuable growth factors.
Okay.
So it's the same thing as when you cut your skin and your skin basically tries to recruit all these different soldiers to go and help repair the skin. It's the same thing, but it's in a more controlled way. So I'm taking those soldiers out of your blood and I'm putting them back into your face where you need repair. Okay? Now, how can we go about doing this treatment? So platelet-rich plasma can be used either by doing micro injections into areas of need, or we can microneedle it throughout the whole face. The really great thing about platelet-rich plasma is you get 6 mils of liquid gold. So that is enough for me to treat his full face, okay? So in this case, I would do micro injections all along his more dynamic lines and static lines around his crow's feet area. I would fill into the nasolabial folds and also into the deeper lines of his forehead. But then I would then go over all of that with a medical strength, medical grade microneedling, going to really, really good depths that's going to really promote collagen remodeling. So essentially you get a 3-in-1 treatment. You get the cellular repair from the platelet-rich plasma, you get the collagen boosting from microneedling, and also you get the micro injections as well for targeted treatments depending on where you need it. Now, in Joseph's case, because his skin appears very dehydrated, I would actually add the kind of the star player of regenerative treatments, and that's called cellular matrix. Cellular matrix is platelet-rich plasma taken from Joseph, but we also add hyaluronic acid, or 40 milligrams per 2 mils, into the platelet-rich plasma. This forms this really amazing product that's going to give you the cellular repair ingredients of platelet-rich plasma, but also give you the hydration, the boosting of elasticity, and skin tension with the hyaluronic acid. So in this case, I think Joseph would benefit from that as well. Now, moving on from platelet-rich plasma, cellular matrix, we also have something called platelet-rich fibrin. So platelet-rich fibrin is just another version of platelet-rich plasma where we add another anticoagulant into it to basically form this fibrin mesh. This fibrin mesh can be used in particular around Joseph's under eyes where he's showing a little bit of sagginess, and also into any areas of collagen deficit. This platelet-rich fibrin will stay in the skin for upwards to 2 weeks for a slow release of your cellular repair mediators. And this can be combined with a normal platelet-rich plasma treatment as well. So this is really, really good where you really want to boost collagen. I also offer polynucleotide treatments as well. Polynucleotide treatments are essentially DNA bases retrieved from salmon DNA. These are cellular messengers that then connect with your cell receptors in your skin to promote collagen. It also is an antioxidant. It also improves vascularity. Also gives us an instant liquid lifting effect that lasts upwards to 48 hours. Now, with all of these regenerative treatments, it's kind of a more of a slow burn. You're going to need minimally 2 to 3 treatments, 2 to 4 weeks apart, depending on the treatment that we're talking about. But I think with Joseph, what's really, really going to improve his skin integrity is the microneedling plus something else, okay? So we can either add something like a skin booster, which is going to be outside of, you know, Joseph's own skin, or we use his own cells to kind of help repair, okay? So I think, Joseph, how does that all sound?
Sounds fine.
It sounds fine.
If I can understand it. Yeah.
So great. So again, Joseph, you know, I would probably recommend the cellular matrix. In your case, I would fully numb your face so that it's really, really comfortable with EMLA or a medical grade topical anesthetic. And then this way we do micro injections and we do a full microneedling as well. And in your case, I would actually recommend 3 treatments, 4 weeks apart, and maintenance is around every 6 to 8 months.